Hello friends, the question is how your immune system triggers psoriasis. Over the period of time, you must have learned that psoriasis is not a skin disease. It's the disease of immune system, and when the immune system gets deranged or there is a defect in immune system, the immune system starts producing more cells than required normally. And since this excess production of normal cells in a person causes excessive skin cells on your skin, and there are psoriasis lesions called as psoriasis wounds where the skin becomes in layers, it becomes thick, itchy, and the dead skin or the live skin cells start shedding away from your skin in the form of scales. So this is what we call as a psoriasis, and normally it starts in head, scalp, and it is called as a dandruff normally that we notice. But this all process is not limited to your scalp, but it gradually spreads on your elbows, knees, and all over body. There are patches, you itch, and lot of skin sheds away. This is what psoriasis is. And you'll be surprised, it is not because of any infection, and your doctor tells you that this is a lifelong disease. It can be controlled for some time, but it will come back again and again, and every time it comes you have to treat it. So the basic question is how the immune system is deviated, deranged, and why it starts producing more cells, and what makes it to make these changes. So let me explain you in a very simple language, not in a scientific language, so that everybody can understand it. You are born with a special type of function in your body that is called as a wound healing mechanism. That is, your skin that you see externally, it's a dead skin, and every 28 days you form a new skin, and this skin goes away and you get a new skin. But every day you shed a little, and in 28 days you completely shed all skin and a new skin comes. But you do not notice it because it's a gradual process. Every day it goes on, and it is a continuous process. But whenever you get a wound or you get a surgery, so then there is a gap or the skin goes away, in the gap is there, wound is there. So does it take 28 days to fill the gap in the skin? No, it takes only 3 days, because whenever there is a wound on your body, the body gets a signal from the dead cells, and it causes your immunity to secrete particular type of hormones called as cytokines, and these cytokines initiate increased blood flow, dilation of the blood vessels to the injured part or wound part, and this leads to production of excessive cells only limited to the wound, and the wound gap is filled up within 3 days. That is, wound is healed in 3 days, but the production of cells is increased. As soon as the wound is completely healed, the increased production of cells by immunity or by the skin cell goes to normal, and then the wound disappears, and you are not noticing where was the wound. The skin becomes aligned with the other skin, and the signs of wound disappear. But just imagine if the body fails after healing of the wound, so again bring the body's reproduction rate of cells to the normal, so body will start producing more and more cells even after the wound. So there will be more skin cells coming out of the wound, and the wound will be live, continuous, and you will get shedding of the cells. So this is what psoriasis is. But in case of psoriasis, there is no wound on your body, but the immunity gets a misunderstanding false signal that there are a lot of wounds on the body, and it becomes active, and all over body in number of spots there is increased production of the cells, and this is what psoriasis is. But what makes this immunity to do that? There are certain causes, because the tendency of a psoriasis is from your parents. You got it from it is when you are born, it is in your body, but it is latent, it is not active, it is passive. That's why you do not notice. But after study, it has been found that it needs certain triggers to get it activated. And what are those triggers? So it has been found there are some mental triggers: change in your lifestyle, change in your diet, change in the environment, and some medicines, some vaccinations. These are the trigger factors. When you are exposed to these trigger factors, the immunity is prone to start psoriasis. So you need to know all these trigger factors. The most commonest trigger factors that we notice, that is, you are having some emotional stress, some insecurity, some sorrow, some emotional setback, failure in exam, love failure, or business loss. So all these things, when they come suddenly, or death of your near or dear one, so this what great impact triggers the immunity for the psoriasis if you have a tendency for psoriasis. And then the psoriasis begins. And once it begins, according to modern science, you cannot stop it. But over the period of time that we have seen, that 40 years ago, the psoriasis used to begin at the age of 30 to 50. But now the commonest age is 18 to 25, and I see small children. So you see the life 40 years ago and life today. So the today's life, the life changes, the environment changes, the food habits. What today are there and what 40 years ago, they have changed. And this new additional change in your lifestyle and your psychology, your mental condition, the world changes, the financial, social, emotional, economic changes. All these changes has created a situation that is harmful for you, and it triggers psoriasis. The first of all, I will mention that all these trigger factors must be taken care of. That triggers your psoriasis. This is number one. If these triggers do not come in your life, so you may not get the psoriasis that early. You can delay the psoriasis. So all these things should be learned. These trigger factors, for example, vaccination is one of the trigger factor. And we have seen in COVID area or COVID time that psoriasis and autoimmune diseases, they triggered in some patients after vaccination. Or all those patients who have psoriasis, their psoriasis was aggravated. So vaccine is one of the trigger factor. So all these trigger factors, when they come in your life, or some addictions like smoking and alcohol, people are not aware of this. If they become aware of this, definitely psoriasis, lichen planus, autoimmune skin disorders can be controlled or can be delayed. All these trigger factors not only trigger psoriasis, but they also aggravate the psoriasis. So during treatment also you need to control them. So this is what the changes in immunity takes place. And once the immunity is deranged, it can only be corrected by only homeopathic medicine. Change in your lifestyle will support the homeopathic medicines to lead you safe, long-lasting psoriasis and lichen planus free life. Thank you.